Hello, professional. This is Dr. Saad, and as you know, we are recording series a lecture for pharmacists who are going to appear for international equivalency exam. In previous recording, we talked about adrenal gland, but due to time issue, lot one point was missing. So let's begin our today's topic from that point. That point was there. That point was about glucocorticoid synthesis and its inhibitor. As you know, that there are certain drugs which play a role in inhibiting this synthesis of glucocorticoids. These drugs are aminoglutathione and ketoconazole, etomidate, meterapone, and trilostat, and abiraterone, and mifepristone, and mitotane. Mitotane. These drugs inhibits the synthesis of glucocorticoid. Similarly, mineralocorticoids antagonists. That drug which acts as an antagonist of mineralocorticoid is spironolactone. This part was missing from the adrenal gland. So let's begin our next topic that was about the hypothalamus and pituitary gland. Point number one is about just an introduction that about the hormones secreted from hypothalamus. That is the growth hormone, releasing hormone, thyroid stimulating hormone, corticotrophic releasing hormone, and gonadotropin releasing hormone. And as you know, that pituitary has two lobes. Anterior lobe of pituitary produces growth hormone, thyroid stimulating hormone, adrenocorticotropic hormone, adrenocorticotropic hormone, luteinizing hormone, follicle stimulating hormone, and prolactin. Similarly, posterior pituitary produces two hormones, that is the oxytocin and ADH, that is known as antidiuretic hormone. These hormones are used by we often antagonize, or sometimes we use this hormone to stimulate various physiological processes, and some of them we will discuss in our abstractive points. That points would be very important with respect to the exams. These We specifically talk about those points which can be part of exam, which can be the part or can be part of MCQ question. So let's move on point number two. That is about the partial pituitary adrenocorticotropic defect. There is a defect that in the production of adrenocorticotropic hormone. It is being detected by the use of a drug that is known as mitoprolol. This drug is actually adrenal cortex inhibitor. So we use this midazolam for the detection of, or you can say for the diagnosis of partial pituitary ACTH defect. Point number three is about the diabetes in spiders. As you know that when our body produces too much urine, it is defined as diabetes in spiders. It can be due to the drugs. It can be due to the deficiency of posterior pituitary hormone. As you know, that posterior pituitary produces antidiuretic hormone. So once there is any deficiency in that, it definitely uncontrolled water will excrete out from the body, and it situation develop similar to the diabetes in spiders. And drugs which causes this diabetes in spiders, that examples are lithium, amphotericin B, and dimeclocycline. The question is that how we would manage the situation. We will specifically use vasopressin receptor agonists for the management of this situation. What will this agonist action do? It will actually increase the tubular permeability. This desmopressin, that is also known as this is belongs to the class that is known as vasopressin receptor agonist. It will increase tubular permeability of water absorption from the body, so from the kidney. So in this way, diabetes in spider situation will be tackled. As long as its dosage form is concerned, it is available in the form of IV, subcutaneous, sublingual, intranasal, and oral formulations. Nasal desmopressin spray is available in the strength of 10 mcg per spray. Similarly, oral formulation is available in the strength of or you can say its dose with respect to patient condition is varies between the 10 to 40 mcg 3 times per day or 2 times per day, or if you want to know in the unit of milligram mg, then it can be defined as the zero point 0.1 to zero point 0.2 mg 2 times per day or 3 times per day. Similarly, injectable desmopressin injectable desmopressin dose is from 1 to 4 mcg once daily or 2 times per day. So this was all about the point number three. About that is the about the diabetes in spiders and its management by the use of desmopressin. Point number four is also associated with it because in this there is a drug that is known as chloropro Chloropropamide. It also has an antidiuretic effect, and it may be clinically useful in diabetes insipidus. But there is a one problem with it, that is it may require several weeks to eliminate from the body. So it can also be part of prescription according to need, side by side the desmopressin for the management of diabetes insipidus. Point number five is about the pituitary tumor. As you know that whenever there is the excessive growth hormone produces, it causes acromegaly, and this is one of the indication, one of the problem of pituitary tumor. So this was some 5 points that was relevant to the hypothalamus and parahypothalamus and pituitary hormone that can be the part of exam. So now we will point number six. We will discuss the summary of all indications or clinical issues, and how we are using or implicating hypothalamus as well as pituitary associated heart drugs to tackle that situation. It will be just a summary. As you know that when there is a case of short stature or increased final adult height, for that situation we use growth hormone. That is the example is the somatotropin for the management of short stature and increasing final adult height. We use somatostatin analog. Its example is the octreotide or octreotide and lanreotide. This somatostatin analog and its example, as I told you, its example, it is used specifically for acromegaly and severe other hormone secreting tumor. Whenever there is a case of acromegaly and several other hormone secreting tumor, we use this somatostatin analog. And lenriotide and octreotide are example of that drugs. We also use growth hormone receptor antagonist. Its example is the pegvisomant, and it is used for the treatment of acromegaly because it acts as an antagonist of growth hormone. Similarly, we use polytropin alpha, polytropin beta, uropolytropin and minotropin for the management of for the ovarian stimulation, for to manage the hypogonadism in man as well as infertility due to hypogonadotropin. This situation is being managed by the polytropin alpha, polytropin beta, uropolytropin and minotropin. Similarly, HCG, as you know that luteinizing hormone analog, its example is it's also known as HCG. In HCG's abbreviation, it is known as human chorionic gonadotropin. The drug which belongs to this class is known as chorioni, uh, chorionogonadotropin alpha, lutropin, and minotropin. These LH analog and its example, which I told you right now, it is used for the for the ovulation for the manage of ovulation during ovulation during controlled ovarian stimulation. It is used for ovulation during controlled ovarian stimulation and male hypogonadotropin. Whenever there is a case of male hypogonadotropin, or when in a under control situation, ovulation is required. Under control ovarian stimulation, ovulation is required. Then these drugs that is known as LH analog, or in other words, we can say HCG, human chorionic gonadotropin hormones. It is used for this purpose. Next class that is now that is very famous. We talked about it in previous lecture, previous video about that. That is known as GnRH analog, as in a gonadotropin releasing hormone. Uh, this class is basically used for a variety of function. For example, I will just mention for the record, that is the ovarian stimulation, controlled ovarian stimulation, and central precocious puberty, block of endogenous puberty in some transgenders, and variant earlier puberty in adolescents, and advanced prostate cancer, and premature LH surge, and during controlled ovarian stimulation. In these situations, we use this class that is known as growth hormone releasing hormone analog. And I've also mentioned some of the drugs that is known as leuprolide, gonadotropin, leuprolide, groceriline, and buceriline, and historiline, and nefarilene, and triptorelin. These are some of the examples of GnRH, gonadotropin releasing hormones, and it is used in all situations which I have mentioned right here. This was all about our GnRH analog. And next class of drug that is known as dopamine agonist. Its example is the bromocriptine, very famous, available in all pharmacies almost, and cabergoline. It is cabergoline. These are used for hyperprolactemia. The dose of bromocriptine that is used for this situation is 1.25 and 1.25 mg daily after every meal, and 1.25 daily after every meal. You can say you have to use bromocriptine on daily basis. Similarly, on other hand, cabergoline drug, it is used 0.25 mg twice weekly or zero point 0.5 weekly, but it is recommended that you use 0.25 twice weekly to manage the situation of hyperprolactemia. Similarly, as you know, in posterior pituitary hormone that is known as oxytocin, it is exclusively used for induction and augmentation of labor and control of uterine hemorrhage after delivery. These are two conditions, that is the induction and augmentation of labor and control of uterine hemorrhage after delivery. To manage this situation, oxytocin is recommended. And desmopressin, I'm sure you are well aware of this. Desmopressin is used for diabetes insipidus, and whenever there is a case of hyponatremia, we use conviptan and tolviptan. This was all about the summary relevant to the pituitary as well as hypothalamus associated drugs, and I also mentioned some of the clinical situation in which these drugs are used. I also there are some three drugs, 3 points further I would like to add in this video, because these points will be discussed in another way in a cardiovascular chapters also. That is that, as you know, that although it is not part of this topic, but just keep in your mind it can be part of exam. Erythropoietin. Erythropoietin is used specific role of erythropoietin. RBC formulation is controlled by the erythropoietin. Erythropoietin is a controlling factor for the RBC production. So just keep in your mind. Spermicidal contraceptives. What are examples? This is a question. Spermicidal contraceptives. Its example, the example of spermicidal contraceptive is nanoxynol. Nanoxynol is the example of spermicidal contraceptive. This is the point. Sorry, just I want to let you know about this nanoxynol. It's a spermicidal contraceptive. And lastly, it is the point that is a drug that is used for prostate cancer, and it's an anti-androgen drug. Its example is the nilutamide. Nilutamide is an anti-androgen drug. It is used for prostate cancer. So after this erythropoietin growth factor and its functioning in RBC formation, we will talk about this topic in detail when we will discuss the topic of erythropoietic growth factors. So let's move on our next topic, that is the bone mineral homeostasis. And as you know that our gland which belongs to endocrine system is parathyroid gland, which play a key role for controlling this bone mineral homeostasis. Before going into detail of points, there is very it's very important to discuss here the mechanism how do parathyroid hormone controls this homeostasis, because our treatment plan actually based on this mechanism. So as you know that the major thing is the blood calcium level. If blood calcium level drops, it stimulates the parathyroid hormone. This parathyroid hormone releases and it starts functioning. Just hold on here. In one direction, in response to drop in blood calcium level, our parathyroid hormone is released. Now move on other direction. That is that, as you know, from sun, our sun ultraviolet rays, our body skin produce. You can say our skin has 7-dehydrocholesterol. In response to this ultraviolet radiation, it is converted into the form of cholecalciferol. This cholecalciferol can also be obtained from the fish and foods. It is known as vitamin D2. Similarly, we also receive ergocalciferol. This is known as vitamin D3. So, cholecalciferol and ergocalciferol, either you obtain from the sun or from the food or from the other vegetable sources, it ultimately goes into liver, and liver metabolize them and to convert them into the form of that is known as calcidiol. This calcidiol is processed by kidney and finally converted into the form of calcitriol. This calcitriol, with the combination of parathyroid hormone, performs three functions. Number one is the osteoclastic action. They will increase the osteoclastic action. That is, I will explain it in a little bit after a while, but just keep in your mind, in this action, calcium from the bone resorbs, you can say resorbs from back to from bone to the blood. So blood calcium level will increase. Second thing is that it decreases urine calcium excretion, and third is it increases intestinal calcium absorption. I would like to revise this point again. The parathyroid hormone and calcitriol, these both synergistically plays a three major role. Number one, osteoclastic action. Number two, calcium urine excretion inhibition, or you can decrease the calcium urine excretion and increase the intestinal calcium absorption. So in response to that, blood calcium level will increase, and our and that factor which actually stimulated the parathyroid hormone to produce and increase the calcium level, that issue is resolved. No blood calcium level is increased. It will give a negative feedback to the parathyroid hormone, and this process will inhibit, or you can say further release of parathyroid hormone will block. So in this way, our parathyroid hormone controls the bone mineral homeostasis and calcium. So calcitriol, or you can say vitamin D, is one of its very, you can say, complementary component. As I told you that if there is a issue in which parathyroid hormone, because when there is a case when there is a hypoparathyroidism, a person is suffering from hypoparathyroidism, then this person is being treated by the use of vitamin D analog. Its example is known as pericalcitriol, or you can say we have to give our that person who is suffering from hypoparathyroidism vitamin D analog, so that its blood calcium level may remain maintained. So our body didn't suffer because of hypo level of parathyroid hormone. So I think so you are well acquainted. This was just for a revision that how parathyroid hormone maintains blood and bone minerals density. So as I told you about a point that is known as the osteoclastic action. It's actually a dissolution and you can say replacement. You can say dissolution of old and damaged bone, and it is being replaced with a new bone. This is in technical, you can say short term defined as the osteoclastic action. On the other hand, there is also known as osteoblastic action. It is known as the formation of new bone and add a growth to existing bone. This is difference between the osteoclastic and osteoblastic action. Our body hormone, for example, if our body has has a normal estrogen, calcitonin, and biphosphonate level, these normal level, as you can say, these hormones, estrogen, calcitonin, and biphosphonate, it actually inhibits the osteoblastic action. So whenever a person is affected by other disease, for example menopause or other hormonal disturbances, in which any of these drugs, any of this hormone level drops in the body are insufficient, then body will definitely go to the osteoblastic action, and this step lead towards the osteoporosis, which we will discuss when we will talk about clinical aspect of endocrinology. So just keep in your mind that estrogen, calcitonin, and biphosphonate inhibits the osteoblastic action. So this was all about our point number one about the bone mineral density and its introduction, and how we would manage, why we use the uh, calci, uh, calci, calcitriol, or you can say vitamin D analog for the management of hypoparathyroidism, and how do parathyroid hormone controls bone mineral density. So this was point number one. Point number two is about an osteoporosis or stunted skeletal development in the children. This is a problem. Osteoporosis or stunted skeletal development in the children. Wherever it is a problem, but this problem is also precipitated by the use of excessive use of glucocorticoid. As you can see, it is one of the side effects of glucocorticoid that it causes osteoporosis and stunted skeletal development in children. That's why prednisolone, it is if it is mandated to prescribe, then it is recommended to give in an alternative day rather than using the continuously to avoid the chances of osteoporosis and stunted growth, especially in children. The question here is how do it work? How do glucocorticoid inhibits this action or causes this precipitates in osteoporosis. It actually do so by three major action. Number one, it antagonizes the vitamin D intestinal transportation or absorption. Number two, it increases the renal calcium excretion, and number three, it stimulates the bone resorption. Through this way, it precipitates into osteoporosis as well as stunted skeletal development. And this was all about our point number two. That was the how do glucocorticoid, for example, its example is the prednisolone, precipitate in the osteoporosis. Point number three is about the osteogenesis. Osteogenesis is a genetic defect in which bone breaks bone breaks easily with the minimum injury. If bone breaks with a minimal injury, it is defined as the osteogenesis. It's a genetic disease. Just keep in your mind. Point number five is about the rheumatoid arthritis. As you know, that rheumatoid arthritis is an inflammation of synovial fluid membrane, and it's managed by the use of NSAIDs and DMRDs, disease modifying anti-rheumatoidal drugs. As we will talk about when we discuss about the NSAIDs and anti-inflammatory drugs, we will talk about its detailed mechanism of action, their examples, their dosage form. Just for I just mentioned here, just for the introduction that how that rheumatoid arthritis it is being how rheumatoid arthritis is being managed. Actually, we use NSAID and DMRDs. So, just I would like to give you one additional detail relevant to DMRDs that, as you know, DMRDs effect may take 2 to 6 weeks to become clinically evident. Similarly, there are two classes of DMRDs. There is one is known as conventional synthetic DMRDs, and second is the biological DMRDs. So was the just introduction of answer and DMRDs, and it is being used in the management of rheumatoid arthritis. Next detail will be discussed in when we will talk about this topic in detail. Point number six is about the penicillamine. Penicillamine is a chelating agent. It used in the rheumatoid arthritis and Wilson disease treatment. As you know, Wilson disease, there accumulation of, or you can say, our body contains high level of copper, or you can say there is a accumulation of copper, especially in brain, liver, and kidney area. This disease is managed by this chelating agent that is known as penicillamine. Point number eight is about the spondylosis. As you know, the spondylosis is an aging of spine, and so you know that disc loss, absorption, functioning. You can say shock our disc, or you can say another word. You know that vertebrae. Between each vertebrae there is a cushion which actually absorbs the shocks. In this, when this shock absorption capacity drops or decreases, due to any reason or due to especially with the ages, it's actually normal aging process. If it drops this shock absorption capacity with the age, it is defined as the spondylosis. The point is that spondylosis or inflammation, this is also a type of arthritis. Similarly, there is a point that sclerosis is generally caused by overgrowth of fibrosis. Just to keep in your mind. And the third point is about the spondylosis of vertebrae, stoppage of blood flow into the part of the body. Just write this to keep in your mind that spondylosis is aging of bone, and it bone with the passage of age drops its shock absorption potential, and it's a type. It's also defined as a type of arthritis. So that was our point. Our point. So our video is going too long, and in upcoming video we will conclude this topic and also resume the next topic of endocrine system. So professionals, if you feel that our this effort is helpful for you, then please appreciate us by subscribing our channel and guide us about our mistakes through your